Good afternoon and welcome to today's talk on recognizing early signs of autism. Thank you for joining us for this year's Baby and Family virtual series hosted by Tallahassee Memorial Healthcare. I'm excited to have the opportunity to unpack this very important topic with all of you, and it's something I'm pretty passionate about. So before we get started, my name is Dr. Allison Moltisanti. I'm a pediatric neuropsychologist at Tallahassee Memorial Healthcare. So that means that I specialize in evaluating children's cognitive functioning and characterizing brain dysfunction when there's been some sort of injury to the brain. So my goal today is to share with you all what autism is, some early signs that you can look out for with your own children, treatment options, and really to emphasize the importance of early intervention. So I'm looking forward to answering all of your questions later in the webinar. And if you think of any questions as we go, please use the Q&A feature in Zoom to submit them, and we'll be monitoring the chat and looking through them and answering those questions at the end of today's talk. Okay, so let's get started. In the middle of the show. Rewinding. So just a brief overview of what we're going to talk about. So we're talking about what autism is, the importance of early diagnosis, signs of autism in toddlers, and teaching you how to recognize those signs, and then what to do if you are concerned about the possibility of autism. Okay, so what is autism? So it's a neurodevelopmental disorder, which means that there is some sort of abnormality in the development of the brain. And these abnormalities are present from birth. As early as the brain begins to develop, this abnormality is present. And these symptoms appear and unfold as the child moves through stages of development. So there are two main areas of symptoms in autism, or core features. I'm going to give just a brief overview now, and then we'll get into details in a minute about those. So the two main areas of symptoms are deficits in basic social skills. And so now I'm referring to very basic social behaviors. They're so basic that they can be seen in infants. And so that involves things like looking at people's faces, having an interest in interacting with people, smiling at others. These are social skills that are so basic that they come naturally to most people without ever having to be taught those skills, but they don't come naturally in autism. The other area of symptoms in autism is what's called restricted and repetitive behaviors. So this covers a range of atypical behaviors, and I'll give a ton of examples, but we see things like repetitive patterns of movement, repetitive play. So you might see some overly repetitive play, like turning light switches on and off and on and off repeatedly. And it's just more repetitive than we would expect a typical child. The other aspect of this is restricted behaviors, which it has to do with patterns of behavior that are narrow in range, or they're limited. We're not very flexible. So one common example is being extremely inflexible about your daily routine and your daily schedule. And even a very minor change to that schedule, which wouldn't bother a typically developing child, is very distressing for someone with autism. I think it's important to know about some very common co-occurring problems that we often see with autism. There is a wide range of intellectual functioning or intelligence in autism. So some children have intellectual disability that co-occurs with the autism symptoms. So that occurs in up to 30% of children with autism. And some children have what's called a language disorder, where we don't develop language and speaking skills and vocabulary the same way as other children do. And language disorder can be so profound that some children have no verbal skills at all. So we refer to them as being entirely nonverbal, whereas other kids with autism have fairly normal language development. So there is a wide range here in what we see with language skills and with intellectual skills. A common question is, what is the cause of autism? And it's a rather complex question, but the main point is that autism is highly heritable. So estimates put it between 60 to 90% heritability. And if you have a first order family member who has autism, you're much more likely, or much more at risk to develop that. There are also environmental risk factors, although their impact is a lot smaller. So around 1% of the variability comes from the environment. So for example, one known environmental risk factor is advanced parental age at the time of conception. So there's really a complex interaction between the genetic factors and some of those environmental factors that have an influence. One point that I want to make is that a common question is whether there is any risk for autism with vaccines, and that's a myth. There's really absolutely no scientific evidence to support that. No study has ever demonstrated that association. And one point that I like to kind of make that more salient is that you can see signs of autism in infants before vaccines are even administered. So it just doesn't make a whole lot of sense. I won't talk about that too much, but if you have extra questions about it, I'm happy to answer them. Okay, so I'm going to talk about why you should care about early diagnosis and catching these signs early, and why early intervention is so crucial. So as we talked about, autism is a neurodevelopmental disorder. It starts at birth, and the earliest signs of autism are going to appear around age 1, and they become kind of more apparent over that second year of life. So we can catch these signs pretty early, and a stable diagnosis of autism can be made between 18 to 24 months. Stable meaning as we age even further, that diagnosis tends to be accurate. Unfortunately, currently, most children aren't getting diagnosed until their school age, so several years later, and they're missing an important window for early intervention. So with intervention, basically, the earlier the better. These early social behaviors that are diminished or deficient in autism that we're talking about, the social skills deficits, those skills are critical in facilitating a child's development. A lot of learning, early learning in infants and toddlers occurs by interacting with people and by being engaged in the social environment. And some of the most basic building blocks for learning language skills and cognitive skills come from social interactions, come from looking at parents and showing parents things so the parents can label, the item that you're showing. Those are some very important building blocks in early development. So when we miss out on those learning opportunities, all facets of development can be behind. So that early intervention is crucial. So if we do get the early intervention on board, we can see improvement in language skills. So a child who maybe starts out nonverbal might become much more verbal. There are even improvements in intelligence with early intervention. So you can see someone's IQ increase because we are getting those developmental experiences on board. And it improves long-term social development. So we're starting out with problems with basic social skills, but over time, we're expected to have more complex social skills and form relationships and have conversations and things like that. And that can be very difficult for a child with autism. And I also think it's important to think about as a child with autism ages, they could have difficulties developing these social relationships, and that can really extend into adulthood. So adults with autism that's untreated can be very impaired. Those difficulties can cause them to be unable to sustain regular employment. It may be hard to get sustained social relationships on board. It may even be hard to establish independent living. And some people with autism never move into living by themselves. So it can be very impairing, and that early intervention can make a huge difference in that trajectory. In fact, some research even shows that some children with early and intensive intervention appear to recover. So the autism almost can't be detected, and they don't seem to quite meet criteria anymore because the intervention was so effective. So what you can do as a parent is monitor developmental milestones. So basically, whoops, I scrolled really far. Okay. So you're going to monitor the major milestones that we know children should hit at certain ages. So for instance, a child should start standing on their own without help from parents around 10 to 12 months. You can look for that marker. Your child should also know 1 or 2 words by around 12 months. So there are a lot of these markers in different areas of development, and if you're keeping an eye on them and even using like a checklist, a developmental skills checklist, then you're going to know right away if there's a problem. And I'll talk about some resources for checklists in a bit. So because early intervention is so important, I'm going to teach you to recognize these early signs of autism so that you can catch them. We talked about the 2 core features, so the deficits in social skills, so that includes social interaction and communication, as well as the restricted and repetitive behaviors. So I'm going to talk about symptoms that fall under each of these kind of areas and signs that go along with them. Okay. So we're going to start out with deficits in social interaction and communication. So the first symptom that falls under here is deficits in social reciprocity, which basically means the back and forth quality of social interactions. So if I was interacting with you, I might call your name, and you'd turn to look at me, I would say something to you, you would respond. So there is a back and forth exchange in interactions, and that really starts from a very early age. That's an innate skill. So children with autism are going to have a hard time with that back and forth. They may not maintain an interaction, or they may not even start an interaction in the first place. So here's some signs to look for. And I'm going to throw some videos in here and there just to make it easier to get an idea for what these things look like. So one sign is that it's hard to get your baby to look at you. So it should be easy for babies to look at you and to look at your face. Babies want to be near you. They should want to look at your face, look into your eyes. And if it's hard to get your baby to look towards your face, that could be an early sign of autism. So if your baby's not looking into your eyes, if they don't keep eye contact while you're interacting, or if they're not looking up to get your attention, so maybe while playing, and if they're not looking for parents' attention, those are some early things that can be concerning. Now, I want to show a video to give a pretty clear example of this. Can we see that okay? All righty. So keep an eye on the eye contact of this toddler.
Lay down, do this. Look at me.
Having some direct social interaction.
Very nice.
Really looking off to the
Lay down, look at me, Shauna, look at me. Look at me.
Not looking at their face or our eyes.
Lay down. Look at Shauna.
And that's a pretty marked example. It's not always that pronounced. Is that working? Cool. Okay. But that level of not making eye contact is a pretty concerning sign. Another sign is if it's hard to get your baby to, if your baby doesn't share enjoyment with you. So babies should be sharing enjoyment with you by smiling, laughing, looking at you, especially if you're doing something fun together or something interesting. So children with autism might smile during something that's fun, but they might not smile at you. They may smile to themselves without adding in that eye contact component, or there may not be a lot of smiling. So if your baby's rarely sharing that enjoyment, especially while you're there with them and ready to interact with them, that can be an early sign of autism. Another sign that kind of goes along with that is that if your baby is not very expressive. So a typical child should have a lot of different expressions. So smiling, frowning, cringing if we don't like something. But children with autism often have very little expressiveness. So they might not smile very much, so it's hard to know if they're happy, or they may not even smile during an activity that you know they enjoy. So one thing that I see commonly is while we're playing with bubbles. So I'll do the bubble thing, and kids with autism will be engaged. They'll want to pop the bubbles, but there's no smiling. So they may seem kind of flat. So again, I want to share another video. I'm going to share two videos here. No, one video. One video of two kids, and it kind of compares their expressions. All righty. So this is going to show two boys who are twins, and one has autism and one doesn't. So I want you to kind of notice the difference between these two boys.
Push.
Smiling, we're playing back and forth with mom, laughing, looking at mom.
Yeah, it fell off. That's right.
Pretty expressive.
Here it is.
Vocalization. Pretty happy baby.
Uh-oh.
Yeah, this is his brother.
Push. Good boy.
Eye contact. I don't see any facial expression.
Ethan, push.
Not really very engaged with this game.
No, stay up here. Stay up here.
Still hasn't looked at mom.
Go. Stop. No.
I'm really having to work to get that interaction
Go.
going.
Look, here it is.
He's really just not interested.
Stay up here, please.
If you'll notice, really throughout the whole thing, we didn't see any expressiveness. So another sign is that your baby doesn't respond when you call their name. So babies should be really attuned to your voice. So when you call their name, they should respond by looking at you, looking into your eyes. They should be pretty responsive to that. They should also respond to other bids for their attention. So if you're saying come here or reaching your arms out, babies should be pretty responsive to that. And if you can't get them to respond easily, that's concerning for autism. Now, I have 2 videos here that's going to show a good response to any being called and a bad response. See if I can get that pulled up. This is a good response.
Kyle
Immediately looks around and keeps looking and is interested. He's pointing and reaching. He's engaged so easily. That is a really good social response. Beautiful. And he is a cutie. And now here is a totally different response. Let's look at Evan.
You want to try to see if you can get him to respond to it?
No. Evan. Evan. Evan.
See maybe if you can get him to respond to
Just
you
by
now,
calling
you can use touch
voice,
with
and
his
that
hand,
didn't
like give
work.
him a little tickle or something.
So now we're going to use
Evan.
touch.
Evan.
Really no response.
Evan.
He likes the tickles, but he's just not giving you too
Little
much
bit
eye
of
contact, but he
smiling.
does smile when you tickle him.
Evan.
No turning to engage with mom, no eye contact. It's really hard for mom to get his attention. If your baby rarely shares their interests with you, babies should be really eager to share their interests and engage you. So they should be showing you toys, holding them up to you, trying to get you engaged in an activity that they're doing. So if your baby isn't sharing interests, that can be a sign of autism. And then if your baby is more interested in objects than in people. So babies, again, should be really interested in interacting with people. It's kind of a theme here. So they may use an object as a way to get your attention, but they should want your attention more than the toy, just in general. And if your baby is just totally focused on the toy, this can be an early sign of autism. Okay, I have one other video about this. Let's see if I can get this one to cooperate. Okay. So look for how this baby is focused on, is this the right one? It is, on the toys versus the people in the room.
That one doesn't have anything that pops. Let's go.
So trying to initiate some play here by picking up a toy.
It's for you, Evan. It's for you.
He's pretty into just the phone part of that toy.
Hello?
I'm trying to
Oh, you want to talk to Evan?
get some
There you
reciprocal
go.
play going on. He didn't really pick up on that. He's not really playing with the toy appropriately. He just wants that handle the phone handle he's holding on to. There's really not a lot of engagement and really much more focused on that toy than on the person that's in front of him. Alrighty. So the next symptom that we're going to talk about here is deficits in social communication. So this can include verbal aspects of communication, so language and also tone of voice. We modulate our tone of voice to express, and that doesn't always happen in autism. We might be really flat. There's also nonverbal aspects of communication. So, and a lot of communication is nonverbal. So eye contact, like we've been talking about, gestures, facial expressions, all these things are nonverbal parts of communication. So signs to look out for is if there really is a limited use of gestures. So babies starting around 9 to 16 months are going to have some different gestures to express their needs and their wants and their interests. So pointing pointing to direct parents' attention to something, or showing, like we talked about, like showing something to parents. That's also an early gesture. That's pretty important. Other more gestures that emerge a little bit later are things like reaching for something to show parents that you want something, raising your arms up to get picked up, shaking your head, giving something, waving hi and goodbye. Those are all some early gestures that we should see. So if your baby is rarely using any gestures at all, that could be a sign of autism, and especially if we're not seeing any pointing or any showing. They're just such early and basic gestures. Another one that's kind of specific to autism really is using the parent's hand as a tool. So because children with autism have limited gestures and other ways to communicate, they sometimes develop some unusual ways to communicate. So this really involves the child grabbing your hand and trying to use your hand to get what they want, and using your hand as that tool. So putting your hand on a container they want you to open. And this is especially concerning for autism if they're using your hand as a tool and they're not making eye contact while they're doing it. I recently had a child who was doing this to me a lot, wanted a toy that was out of reach, and so was pushing my hand towards the out of reach toy and really looking at my hand when he wanted something, not looking at my face, which was a big sign. If it's hard to get your baby to look at you while gesturing and making sounds, that can be a sign of autism. It really should be easy for your baby to use all of these ways to communicate at the same time. So looking at you, gesturing with a reach, and maybe even making a sound together. All those things should happen together to be effective communication. So if we're reaching but no eye contact, that's more concerning for autism. Language delays can be an early red flag. These aren't necessarily specific to autism, but can certainly be concerning. So if your child isn't saying a single word by 15 months or isn't saying 2-word phrases around 24 months, those can be some early red flags and things that are easy to monitor and do some early intervention. Last sign under this topic is little interest in communicating. So if your child isn't really trying to start conversations with you, if they're not offering information about themselves, like talking about a toy that they like, or just kind of sharing those interests and initiating those interactions, that could be concerning. So next, we're going to talk about signs that fall under restricted and repetitive behaviors. So the first symptom here is stereotyped or repetitive patterns of speech, movement, play. I know stereotyped is a word that is really commonly heard when we're talking about autism, and that has to do with a basic repetitive action that's done over and over, but without a clear purpose. So children with autism often have overly repetitive ways of speaking or behaving without really a clear function to those behaviors. So some signs to look for are unusual movements of hands or fingers or the body. So you may see some stiffening or flaring of fingers. This one is common, or twisting fingers repetitively. There can also be unusual whole body posturing, like posturing and tensing the body unusually and becoming really rigid. There can also be hand flapping is a very common thing that's thought of in autism. Other whole body movements can be things like rocking, spinning, bouncing in place. Some of these behaviors really overlap with ADHD. They're not specific to autism, but if they're seen in conjunction with a lot of these other signs, it can be more concerning. And I have a video of a really good instance of a repetitive movement. Okay. So this kiddo has autism, and let's take a look. So I'm not sure if you can hear the audio. There's a toy box playing, and it's stimulating, so he's kind of doing some of his repetitive movements. So that hand movement back and forth, the flapping, is very stereotyped, the way that he's doing that. And you see it's really repeating for quite a long time. That's a pretty good, clear example of a pretty repetitive behavior. There are also repetitive or unusual movements with objects. So things like lining up toys. So as you can see in that picture here, this child has lined all of his toys up in a row. The child might, play with Legos just by lining them up and not by playing with them in a more complex way. Other movements can include, a child always wanting to twirl a toy in front of their eye every time they pick up a toy to look at it. That's that kind of repetitive behavior. And there can be other repetitive actions like opening and closing doors repeatedly, and that's sort of an enjoyed repetitive activity. And then one other interesting sign of autism is when a child repeats exactly what someone else says, which is referred to as echolalia. And this can happen immediately after, or it can be delayed, and they're repeating a phrase they've heard, but it's a little later on. And it's often when it's repeated without meaning and without understanding, and you can often see that it's repeated in the exact same tone. And I have a pretty good video of this as well. So listen closely for some echolalia here. It happens a couple times.
Hi, Lucas.
Immediately repeats, "Hi, Lucas." He's saying his own name.
Give me a hug. Come here. Come here. I gotta tell you something. Hi. Give me a big hug. Oh. How are you?
How are you? Repeats it, and almost repeats it in a manner that it doesn't sound quite like he knows what the words are. He is just repeating the sounds he heard her make. That is a pretty good instance of echolalia. So the next symptom area under the restricted and repetitive behaviors is inflexibility, or rigidity, or resistance to change. So children with autism can be excessively rigid about routines or may struggle a lot even with very minor changes. Some signs to look for if your child develops very intense or unusual rituals. So most babies, typically developing babies, learn routines pretty easily, like they like the getting ready for bed routine. And a typical child will flow with changes in the routine. So if you add a step or you have to remove a step, usually that's okay. It's pretty tolerable. Children with autism may develop some really specific rituals and then become very unwilling to deviate from those rituals. So a pretty clear example would be if a child insists on turning in a circle 3 times before opening a door. I've heard a lot of the child insists on being the one to close every door before we leave the house, and that's a ritual. And it can be very distressing if they can't carry out that ritual. They also might just make up some kind of unusual rituals. I had a child who every night before bed wanted to say one word to describe every single activity of the day, and that was the ritual, and she did that every night, and no one taught her that. She just came up with it. There are definitely some normal routines, and it's actually pretty normal for a child to be to like to conform to a bedtime routine. That is pretty typical. But if we're seeing unusual routines or really intense reactions to changes in routine, that's more concerning for autism. Another sign is insistence on sameness. So really has to do with the child insisting that things be in the same way every time they do them, or not liking change and being very upset over unexpected change. So this can be that your child really does not like when the furniture is moved in the house, or maybe when things are rearranged at the kitchen table and becomes very distressed. A child might insist that food be prepared in a very particular way, or they may become very upset about a very minor change to a schedule. So I had a child who was upset about parents wanting to go get ice cream later on that day, but it was unexpected. It wasn't part of the schedule. So that was very distressing, even though children love ice cream. The next symptom that falls under restricted and repetitive behaviors is highly unusual or intense interest. And this one can get pretty interesting. Oh, there's the bullet point. So some children with autism can develop very intense interests or become interested in something that's pretty unusual for their age. And they can also have sort of a narrow range of interests, like really only liking monster trucks, and that is the only thing they want to play with, and that's all they want to talk about. So some signs to look out for: excessive interest in a particular object or activity. So babies should pretty readily shift their attention between objects and people, creating that opportunity for social interaction, and not just being focused on the item itself. So babies with autism may become excessively interested in a particular object or activity and just get overly focused on that object and not be kind of doing the back and forth of looking at a parent And if you think back to the video of the kid who had the phone and the examiner was trying to interact with the kid was just focused on that phone, just excessively focused on that object. I commonly see, I do some kind of play activities with kids with autism when I'm doing diagnostics. And one really common thing is that kids get very interested in this Jack in the Box toy that I have. And that is all they want to do. And I have a lot of really cool activities that we move through, but they just want that Jack in the Box for the whole hour and don't really want my attention. So it's a fixated interest on that. So intense interests at an early age can actually lead children to develop some advanced skills for their age, which is interesting. So some children become really interested in letters and shapes at an early age, and they can actually start to learn early literacy skills because of this intense interest, which is atypical. Sometimes kids with autism become very focused on unusual objects. So one really common example with autism, which is interesting, is becoming really interested in things like vacuum cleaners, things that they can take apart. And some kids will even start a collection of vacuum cleaners, and they'll know the model and the make, or I don't know how you categorize vacuum cleaners, but they'll know all this information about vacuum cleaners. Like, why vacuum cleaners? Or there can be more simple objects. Like I had a kid who was obsessed with toothbrushes, and we had toothbrushes everywhere, in the car, in the house. He had to have a toothbrush everywhere he went with him, and that's an unusual thing to be very, very interested in for a toddler. So you might see obsession with a piece of cloth, a spoon, and bringing that everywhere with them. Also, you could see an excessive focus on a non-functional aspect of a toy, like really being into the wheel of a toy and not the rest of the toy itself, or like a knob and not really caring to play with the whole toy. That's an abnormal focus of interest. Oops. I also skipped the second part of that. So there can also just be very unusually intense interests or preoccupations. So you can see this area of interest that is just totally focused on one thing. So there's some themes in autism that come up a lot, some interest. So a really common one for a while was that kids were really into Thomas the Train Engine, and that interest is so intense that it predominates all their other interests, and that's all they want to do. I've also had some kids that get really interested in things like a particular historical event, or I had one kiddo that was really interested in tornadoes. He knew everything there was to know about tornadoes. He wanted to get sucked up into a tornado. That was his dream. So that intense focus, and especially at a young age, is unusual. Okay. The next symptom under restricted and repetitive behaviors is hyperreactivity or hyporeactivity to a sensory input. Basically meaning when we're talking about sensory inputs, sound, light, smells, tastes even. Sometimes children with autism are overreactive to those things. It's too intense. And sometimes they're underreactive, like they don't actually sense it as much as you would expect. So sometimes to look for are unusual sensory interests. So babies with autism can have really strong, unusual sensory interests, like being really interested in inspecting a block and looking at it very closely from every side, maybe holding it really close up to their eyes. That's a common thing to see, is we're holding toys and looking at it really close to our eye. Or as you see in this picture here, one thing that some kiddos with autism will do is they'll look at things from odd angles. This is a sensory thing, like looking at something and wanting to see it out of the corner of their eye. There could be an extreme interest in watching the movement of something, like the spinning blades of a fan, or the wheels of toys, just looking at how it moves. Being preoccupied with texture or touch, like wanting to rub your face on things. Like I've had some kiddos who want to explore new objects. Every object has to touch their face when they're exploring new objects, which is unusual. Or wanting to smell or lick every item is also unusual. There can be sensory aversions. So this isn't entirely specific to autism. A lot of kiddos are sensitive to things like loud noises, but when it's really extreme, that can be a sign. So babies with autism can be very sensitive to specific sounds, to loud sounds, to certain sights or textures, and their reaction might be unusual. So if they hear a loud noise, they might cover their ears. One common example is if you hear something particular, like the sound of foil, aluminum foil in the kitchen, that's very aversive, and we're covering our ears. There might be some arm flapping, even like really intense, unusual blinking. There can be, oversensitivity to certain food textures and tastes, and children with autism might even gag. They might have a really hard time tolerating certain foods and textures. They may be really bothered by sticky things on their hands, the way things feel, tags in clothing, etc. And then the last one, which is interesting, is insensitivity to pain. Some children with autism just do not seem to feel pain in a normal way. And one example is I had a kiddo who broke his clavicle, and kiddo with autism, and just had no awareness of that pain. He was running around, flailing his arm, and any normal adult or child would be in a great deal of pain. So that's a pretty unusual presentation. Okay. That's the review of the red flags, the signs, the things to look out for. Something that you should keep in mind is that we are looking for a collection of these symptoms. So if you're only seeing one of these signs or symptoms, that might not signal a problem. And sometimes things like, you can sometimes see things like hand flapping in a typically developing child every now and then, and that in isolation doesn't necessarily mean there's a problem. So we're looking for a collection of these symptoms. If you're seeing 4 or more of these things, that's maybe the time where further evaluation is necessary. So what do you do if you're concerned about the possibility of autism? So first stop should be to discuss your concerns with your pediatrician. So your pediatrician can screen and do a screening where they're looking for some of these signs, and then refer for a more in-depth evaluation where they would come see somebody like me to do some diagnostics. Pediatricians should be doing periodic developmental screenings as it is, so they may already catch some of those signs, but they don't catch everything. And autism can sometimes be subtle, especially during a brief doctor's visit, because you really have to elicit some of these social behaviors through interaction. So if you're noticing some concerns, be sure to come forward and mention it to your pediatrician. Don't just assume that they're going to notice it. And there are sometimes some issues with kind of the wait and see approach with pediatricians. So with these early milestones and early developmental behaviors, there is a normal range. Not every kid learns to walk right at 10 months. Some kids lag behind a little bit, and there's this normal variability. So sometimes pediatricians just want to wait and see. And I guess I want to caution you not to get too much stuck into that trap where we're waiting to see, and then it's years later before we actually get some early intervention, because we're missing this important window. So don't be afraid to be an advocate for your child if you feel that you need to, and if you feel you're not getting the attention that you need. So who can diagnose autism? So physicians can diagnose autism, and this would often come from either a pediatrician or a child psychiatrist, but they often don't. And it's because it can be a difficult thing to diagnose, and it takes some really specialized training to be good at diagnosing that. So often they're going to refer. So you would more often see a clinical psychologist who can do a full evaluation, or a school psychologist. Sometimes the psychologists in schools are comfortable doing the evaluation. Under the age of 3, though, probably just going to see an outside psychologist, since we're not in school yet. And a formal diagnosis is important, because that's often needed to get insurance to cover treatments. Okay, so what interventions work? So it is important. There's no cure for autism, but the interventions can cause substantial improvement in symptoms. And these interventions are going to target these core areas of deficit: social skills, language, intellectual abilities. And we need to see early and intensive interventions. The earlier the better, and several hours a week is usually what's optimal. 1 hour a week is probably not enough. So I'm just going to give a super brief overview about the types of interventions you'd be looking for. So ABA therapy is kind of the most popular and most widely used intervention for autism. And it's basically going to try and teach kids some of the behaviors that they are missing out on, that just don't come naturally to them. And they use rewards and consequences to kind of teach some of these behaviors. It's a pretty intensive therapy, and it's really best if parents are involved with the therapy and learning to use some of the same strategies at home, so we can see intervention across contexts. Another important aspect of intervention in autism and in any developmental delays is to get involved with this general early intervention that's available through local state programs. The state program for Florida is called Early Steps. So they can help with developmental evaluations, and then they provide a lot of different services to help children who are lagging behind. So speech therapy, physical therapy, occupational therapy, and speech therapy is particularly relevant for children with autism because of the language and communication component. For a child who's slightly older, ages 3 to 5, they can get early childhood special education through the school system. So like early voluntary pre-kindergarten. So there's a lot of resources out there for kiddos who are young. There's stuff starting from birth that's available. And if you are if you are concerned about autism, if your child gets a diagnosis of autism, I do recommend that you seek some assistance from some supportive organizations, because it can be difficult to navigate all of this. There's so many interventions out there. There's so many different types of providers. It's overwhelming and confusing, especially if you're new to all of it. So there's the Center for Autism and Related Disabilities. They have chapters throughout Florida. So ours is FSU card. So it's affiliated with the university. They're excellent. They're basically a patient navigator service, and they will, once you get the diagnosis, they're going to let you know what next steps are. So there are resources out there. This is just a brief overview of some important resources. One that I want to point out is a website called the Baby Navigator. This is a website that's designed to just help you track your baby's developmental milestones with an emphasis on social and language skills. But it's really it's helpful for any parent, typically developing children, or if we have concerns. And it will help you to identify things early. They do developmental screenings, and it's just going to help you to monitor. You can also use things like the CDC developmental milestone checklist to monitor. But I think the Baby Navigator is more comprehensive. And there's some other resources listed here that we talked about. Okay. That brings us to questions. Are there any questions currently? We are in chat. I'm going to stop sharing 3. Oops, yeah. Okay. I don't see the chat. Okay. The question is, do focused specialized items sometimes include people becoming attached to a person? That's an interesting question. I think that might be a slightly different manifestation. Children with autism, even though there can be some reduced social interest, there's not an absence of social interest. And so often comfortable people that we're really familiar with, there can be some kind of latching onto that person. And that's a little bit different from being particularly obsessed with an item that is inherently not social in nature. But that's certainly something that you can see. One question is, can you talk a little bit about what it means to be on the spectrum? That is a super good question, and a little bit of a complex one to answer. So we talked about how there's a wide range of intelligence, really ranging from like low ends of the extreme to some children with autism are really bright and have above average intelligence. There's a wide range of language skills. And then even within all the symptoms that we just went through, there can be a lot of variability in what the symptoms look like. So some children have really diminished social interest, and they're very disengaged, and they really don't want a lot to do with people. They keep to themselves, they stand in the corner. But then some other children want social engagement, but they still have these limited social skills. So the spectrum kind of refers to that all of these symptoms are on this continuum where we can have high or low amounts of that symptom, and it ranges so much that it can be kind of hard to say every child with autism looks like this. There's a lot of variability. It also can range just in terms of some children have very mild autism that's a little bit harder to detect, and some children have very significant autism that's very profound and impairing. Let's see, what other questions? What differences might you see in diagnosing boys versus girls? So it's a good question. Autism tends to be, it's more prevalent in boys, and it tends to be more commonly diagnosed in boys and missed in girls. In my experience, the symptoms present fairly similarly, but you might have different expectations for a boy and a girl. So we might expect boys to be more outgoing and things like that, and that may kind of taint how we look at the symptoms. The other thing is that Where there are things like hyperactivity and something that is a lot more present in boys. Boys can be more hyperactive and they can be a little bit more destructive. And so sometimes they just get on people's radars earlier. But really those core symptoms, those social pragmatic deficits where we're not engaging, we're not looking at people, and those basic social skills, you're gonna see them pretty much the same between boys and girls. Why is there hesitancy regarding diagnosing before age 3? That is an excellent question. I think it has a lot to do with confidence. Certain providers knowing that they know that population well enough to get that diagnosis. It's, it takes a lot of training to be skilled in diagnosing autism, and I think people are hesitant for reasons that have less to do with diagnostic certainty and more that it's a big label to provide, and you have to be very familiar with the developmental trajectory of a toddler to be confident this is autism and not something else. That being said, as we talked about, early diagnosis is one of the most important things for intervention. And it can be reliably diagnosed. I think it may just come down to training and confidence and experience with that population. So I would recommend finding providers that are comfortable, that regularly see children under 3. And there is a big push right now in the research world with autism and with pediatricians. This is really a huge area of focus and research funding to move to diagnosing at a younger age. Are there often co-occurring disorders? Some of these signs and symptoms sound like OCD. That's an interesting point. There are certainly co-occurring disorders. The most common ones, like ADHD, is very highly co-occurring, as well as we talked about language disorder and intellectual disability. These symptoms sound like OCD, but they are inherently different. Repetitive behaviors are like purposeless, and they're just sort of self-stimulatory. In OCD, we have specific anxious thoughts and worries that refire repeatedly. I'm really worried about germs and contamination, and then we develop rituals to compensate for those things. Or there can be some compulsive behaviors as well, and there can be some overlap. But that's why the evaluation is important, to really distinguish between these similar looking symptoms. And no more questions, it looks like. I don't think there's anything else that I wanted to add, so we can wrap up there. So that brings us to a closing. So thank you very much for joining. If you'd like to learn even more about pediatric neuropsychology services available at TMH, you can visit tmh.org/neuropsych. And I hope you'll join us for the remainder of the Baby and Family Fair virtual speaker series. So we have 2 webinars scheduled for tomorrow, including an expert panel on navigating high-risk pregnancies, and that's at 12 p.m. And to see our full lineup, you can visit tmh.org/fair.